Beta-glucans are found in baker's yeast, mushrooms and cereal grains. They can help the body to fight cancer and various diseases. When it comes to naturally boosting the immune system by optimizing its response to disease and infection, the beta-glucans are crucial weapons in the fight to stay healthy. But because the body doesn't produce beta-glucans naturally, the only way to get the compound is through outside sources. After a century and a half of research, studies have shown beta-glucans act as immunomodulator agents, meaning they trigger a cascade of events that helps to regulate the immune system, making it more efficient. Specifically, the beta-glucans stimulate the activity of macrophages, and these are versatile immune cells that ingest and demolish invading pathogens, and they stimulate other immune cells to attack. The macrophages also release cytokines, and these are chemicals which, when secreted, enable the immune cells to communicate with one another. In addition, the beta-glucans stimulate lethal white blood cells, or lymphocytes, to bind to tumours or viruses and release chemicals to destroy them. Beta-glucans have been used for immune system support since 1980, mostly in Japan. In addition, the beta-glucans have been shown to reduce the total and LDL cholesterol. They're not produced naturally, therefore they have to be obtained through diet or supplementation. You've probably heard about the heart health benefits associated with a diet that includes consuming oats. That's partly because oats are a good source of the soluble fibre beta-glucan. In a study conducted by the US Department of Agriculture, it was found beta-glucans are concentrated in the oat fibre. Male and female study participants with mildly high cholesterol were put on a maintenance diet for 1 week, and then they were given an oat fibre extract containing either 1% or 10% beta-glucan. After 5 weeks of receiving the beta-glucan extract, both groups showed a significant reduction of total cholesterol and low-density lipoprotein. What's more, the total cholesterol levels were significantly lower in the group who received the higher beta-glucan extract than those who had the lower one. With about 560,000 deaths from cancer each year, researchers have spent decades searching for substances with cancer-fighting properties. Lentinin, a type of beta-glucan found in shiitake mushrooms, is believed to reduce tumour activity and lessen the side effects of cancer treatment. Researchers in Taiko University Biotechnology Research Center in Japan showed the lentinin has anti-tumour properties, suppressing the formation and the development of tumours. Results on the clinical application of the lentinin have proven the prolongation of lifespan of the patient with advanced and recurrent stomach, colorectal and breast cancer, with only little toxic side effects. It also appears the lentinin restores or boosts the responsiveness of cytokines, which interact with the immune cells and regulate the response to disease. In an earlier Japanese study, mice with tumours that received beta-glucans, including lentinin, experienced a rapid decrease in the number of tumour cells, as well as a notable increase in neutrophils in solid tumours. Neutrophils are a type of white blood cell that destroy invaders, in this case the cancerous cells, by ingesting them and using chemicals to break them down. In fact, beta-glucans have been used as immunoadjuvant therapy, an immune stimulant, for cancer since 1980, mostly in Japan. In addition to beta-glucan's assistance in fighting against cancer, studies have shown it also helps the body to battle bacteria resistant to antibiotic treatment and viruses that cause upper respiratory infections. At Brigham and Women's Hospital in Boston, Massachusetts, researchers found the compound enhances antibiotic efficacy in rats who were infected with antibiotic-resistant bacteria. Rats with intra-abdomen sepsis due to antibiotic-resistant bacteria, namely E. coli or Staphylococcus aureus, were given a type of beta-glucan that enhances the function of macrophages and neutrophils. The researchers looked at beta-glucan's ability to work in partnership with antibiotics to decrease mortality in the rats. Results of the studies demonstrated that the prophylaxis with the beta-glucan, in combination with the antibiotics, provided enhanced protection against the lethal challenges with E. coli and Staphylococcus aureus when compared to the use of antibiotics alone. Further animal research highlights beta-glucan's impact on a form of E. coli, the culprit behind travelers' diarrhea. Belgian scientists orally administered 3 different beta-glucans to pigs with E. coli infection that had just been weaned. The study found the pigs fed for 2 weeks after weaning with the beta-glucans were less susceptible to the infection. This was evidenced by lower incidence of diarrhea compared to the control group. The study showed the beta-glucans can protect against the E. coli infection. This is the first in vivo study where the use of beta-glucan as a feed ingredient was tested to protect against E. coli. Beta-glucans also appear to mitigate the symptoms of the common cold, or at least reduce the number of days that people call in sick to work. The Montana Center for Work Physiology and Exercise Metabolism examined beta-glucan's ability to mitigate the upper respiratory infections in a single-blind randomized trial in 2008. The scientists chose firefighters as their subjects, since they're regularly bombarded with smoke and fumes as they battle blazes and are more susceptible to respiratory troubles as a result. Researchers provided the group of firefighters with either a beta-glucan containing supplement or placebo, and they asked the participants to write down any cold symptoms like runny or stuffy nose, sore throat, cough, sneezing, or coloured discharge, or flu symptoms like fever, headache, general aches and pains, fatigue and weakness, chest discomfort, or cough. The firefighters who recorded having these symptoms for 2 consecutive days were classified as having an upper respiratory tract infection. The participants who consumed the supplement with beta-glucan had 23% fewer upper respiratory tract infections compared to the control group. Although there isn't a single magic bullet when it comes to eliminating disease, lots of research shows adding beta-glucans to your diet, either in the form of supplements or food, can significantly play a role in helping your body to fend off not only the common cold and respiratory infections, but also more serious diseases, including cancer. Beta-glucans have been used as an immunoadjuvant therapy for cancer since 1980, mostly in Japan. For more on herbs, supplements, and natural treatment plans, check out my website.